Hello and welcome to Shreveport Bossier Metro Talk. I'm Anna Maria Keele, and we're talking today with Lillian Campisi about a topic that enters many women's lives every year, breast cancer. So stick with us, and when we come back, we'll be talking with Lillian about her experiences.
Do you have something to say but don't quite know how to say it? Let flowers say it for you. Whatever the occasion, our florist at Country Village Florist and Gifts can arrange a flower bouquet of your choice and deliver it to that special someone all in the same day. Or if you're browsing for a gift item, we may have exactly what you're looking for. For over 12 years, we have maintained a reputation for excellence and customer satisfaction. Come by today. We're located at 4615 Highway 80 in Houghton.
Registered nurse Faith Peace and the Hands of Peace staff provide exceptional care for our clients, from folks who just want to relax to those with more challenging conditions. Our healing stone therapy is best for overall relaxation and therapeutic relief, actively using warm stones to melt the knots away. We have 2 locations to serve you, in the Bossier City Office Park at Old Minden and Northgate, and inside the BX Mall on Barksdale Air Force Base.
Welcome back. We're here today talking with Lillian Campisi about a topic that has been in the forefront of women's news for many years, breast cancer. But let's find out a little bit about Lillian first. Lillian, tell us a little bit about yourself.
Well, I am from Spring Hill, Louisiana originally, and came to Shreveport like a lot of young women do after they finish high school. There's nothing much to do in Spring Hill, so you have to come to the big city, so I came to Shreveport. And I went to business school, became a secretary, and I worked at a couple of other places, and then I got a job with the American Red Cross. And I was public relations director there. I worked with youth services, and every time we had a disaster, I was always out working on disasters. And then from there, I left the Red Cross after 22 years of service and went into business for myself. One thing I also did with Red Cross was teaching first aid and CPR. So that's what I do on my own now, is teach first aid and CPR for business and industry.
So you've had a background of helping people all throughout your career, haven't you?
Yes.
And the CPR aspect and first aid has given you a little bit of an insight into medical things and taking care of yourself and others.
Right.
Let's talk a little bit about something that's happened to you, I think, right in the last 12 months.
Yes.
Tell us how you found out that you had breast cancer.
It was last October. I do pretty regular checks, just to check, everybody should check on a regular basis. And I just felt something that I had never felt before in there, and I said, what is this? And it was a little lump. And so I didn't say anything to Michael. Then the next day I said, Michael, I think I got to go to the doctor.
And Michael's your husband, Michael
Yes,
Campisi.
Michael Campisi. And
now let me ask you this, because the question that comes to mind immediately is, was it something that you think grew within a month's time, 2 months' time? How long did it take before you actually felt the lump?
I usually would check about every 3 or 4 weeks, so I mean it hadn't been there very long. I didn't feel it before.
Okay.
And so I told Michael, I said, I have a lump in my breast, and I said I got to go get it taken care of. And being self-employed, that like both of us are, and like many self-employed people, we don't and can't afford a good insurance policy or anything. So I said, where are we going to go? So I said, well, I think I'll call the Susan G. Komen Breast Cancer Foundation. So I called Susan G. Komen and got a message, and I left my message on there and told them what I was looking for. And someone called me back And they told me that probably the best thing to do is just go to LSU and get checked out, and then they would point me into the right direction.
And so your interaction with Susan B. Komen Foundation was a good one.
Yes,
Yeah.
yes, and she told me that I needed to do this, kind of don't wait, just
Right.
go ahead and do it. So
'Cause a lot of women do. They wait.
Right.
And they think, well, maybe it's nothing, maybe it'll go away. But that's
Yeah.
really not the thing to do, is it?
No, because you don't know. You don't know what this thing that, has just appeared, in there, and you're feeling it, and you didn't feel it maybe 2 weeks before,
Right.
And you don't know what it is. I mean, it could be something that would just be a little abnormal growth, and they can just take it out, or it could be cancer.
Okay.
So I went to LSU Medical Center, and they put me through all the I got checked out from head to toe first, and then they sent me over to get the mammogram and everything, and something did show up on there. So then they sent me immediately to Feist-Weiler Cancer Treatment Center right next door to them. And
Let me ask you this question. As you're going through this process and you've had the mammogram and you've gotten some of the results showing an abnormality, what's going through your mind?
Well, you always think that C word, that cancer, you think, oh gosh, I hope it's not cancer, and you're always wondering, oh, is it really? And you thought, well, maybe not, maybe it's just something that, just a little growth or something, they can take it out and everything be fine.
Right.
Well, I went to Feist-Weiler Cancer Center, and my sister, Verda, goes with me to all of my appointments just about, so she went with me, and there we go in to get checked, and after they got the results back from the tests and everything, then the doctor gave us the news that, it is cancer.
And we're going to keep coming back with you, Lillian, but we need to take a little bit of a break. And when we come back, we're going to pick up with the first initial diagnosis of cancer and the next road ahead for Lillian.
Hello, and welcome to Ellis Home Decor and Garden. My name is Destiny, and today we'll be talking about how to decorate your home with just a few home furnishing items that will bring the color, style, and atmosphere of your home alive with a few simple items such as artwork, tables, mirrors, lamps, accessory items, and more. The furniture accents and colors can really create the whole theme of your room, which you can simply build upon, such as these pieces of furniture. Decorative mirrors also bring life to the walls. Whether they're oval shaped or horizontal in length, mirrors can have bronze, gold, or silver borders with all types of trimmings. Adding one to your room with the right color border can add elegance to your home. Artwork is an important part of setting a tone in your home. It ties together the colors and themes of your furnishings. It also brings out the accents of your pillows or adds some colors to your walls, and we have several styles of art to choose from. It's the decorative items that bring the total look together and magnificent run patterns and design that set the whole mood of the room. A few centerpieces and home decor items such as these would be perfect for any home. I would like to thank you for joining me at Ellis Home Decor and Garden as we explored several different ways to decorate your home with just a few simple items. I look forward to seeing you here.
Do you have something to say but don't quite know how to say it? Let flowers say it for you. Whatever the occasion, our florist at Country Village Florist and Gifts can arrange a flower bouquet of your choice and deliver it to that special someone all in the same day. Or if you're browsing for a gift item, we may have exactly what you're looking for. For over 12 years, we have maintained a reputation for excellence and customer satisfaction. Come by today. We're located at 4615 Highway 80 in Houghton.
Welcome back. We're here talking with Lillian Campisi about her experiences with breast cancer, and we just got up to the point where she was diagnosed with cancer. So Lillian, what happened when you first heard that it was the big C?
Well, of course, you tear up and everything because you're not wanting to hear that. You wanted to hear them say, "Oh, well, that was just some little benign growth on there, and we'll just take it out just for the heck of it, And
Were they able to diagnose it from the mammogram, or did you have to undergo a procedure so that they could determine that it was indeed cancerous?
We did the mammogram, and then they drew some blood from that area.
Okay.
And it revealed that there were cancer cells in
Okay,
there.
gotcha. All right. So you're there with your sister, and the doctor's giving you the diagnosis. What happens next?
Well, we both get tears in our eyes, trying not to cry or anything, because, it just...
It's shocking.
It is shocking, you don't want to hear that. You're wanting to hear, everything's going to be all right. Is what you're wanting to hear. but it wasn't. But he was very, very good. He says, don't worry. We're going to take care of this. You're going to be all right. We're going to take care of you. And really, they really did. They did take very good care of me. I had a lumpectomy done in the hospital there. And
Now, how long between the diagnosis and the lumpectomy? How many days or weeks was it?
I can't remember exactly now, but I would say probably about 2 or 3 weeks later. They didn't really wait a long time for it.
But 2 or 3 weeks is a long time to be thinking about that and worrying.
But they told me that it was very small, and so they thought, that they would be able to get it all with no problem. And
Right.
so they were very reassuring. And it being a cancer treatment center and everything, I figured they probably knew what they were talking about, because I know they had a lot of people in the same situation that I had been.
Right.
And so had the surgery and had the lump removed, and then they did test it, and it was a fast growing, a very aggressive cancer. And so with that, then they ordered, first I had, like the chemo. They did chemo, and I had 4 rounds with that. I had some allergic reaction to one kind that they were giving me, and it gave me tremendous pain up my spine. And
Well, let me ask you about the chemo, because that's something that we don't know. If you haven't gone through chemo, you don't really know what chemo is about.
Right.
First of all, was the chemo provided to you right there at the Feistweiler Cancer Center?
Yes.
Okay. And when you go in for a chemo treatment, what is that like?
They take you to the treatment room, and you see other people there. They're hooked up to IVs, and they got the little bag up there dripping, and so they just hook you up to one, and you have a nurse that's assigned to you, and she hooks you up, and then when they get the right dosage and everything from the doctor and everything that they request, then they administer that, and you're sitting there with other people. It's kind of nice, friendly, have chats, because you have things in common with other people that are in there, and everybody's in there for the same reason. So it's really kind of a nice little group of people there, that you get to make friends with, and you get to talk with them, and comparing experiences. And you realize that you're not the only one going through this. Other people are going through, and you listen to some of their stories. Some of them are further along in their treatment maybe than you. When you're a first time, then they'll tell you, it's not really that bad. And
They'll reassure you and give you some of their experience.
And it really was a very comforting thing, to have other people in there who could be so positive, and then you get to talking about experiences and everything, and then you laugh and you talk about things, and you just really form a camaraderie with those people in there, because they're going through the same thing.
Do you get the same nurse each time you come back, or is it a different nurse assigned to you?
I see the same ones. It might be, there's 2 or 3 of them that I've had, and all of them there have been very, very excellent nurses. And then they'll start sharing things in their life and things that they've gone through, and they're just real people, and they're just really honest with you about what's going on.
How long was your course of chemo?
I've had 4 treatments of chemo, and one thing with chemo is sometimes your memory is not as good as it should be. So I can't remember exactly how long apart. I would say maybe 3 or 4 weeks apart or something. Each dose. They give you time to kind of recuperate from it. And I don't remember it. The first time or 2 was not really that bad. I would say the latter 2, except for the time I told you I had the allergic reaction, and they changed the type of chemo I was getting after that, and I had no more problems with it. But there were things, you just maybe didn't function as well at home and everything, you were kind of in la la land is what I call it, for a little bit. And
Was it tiring? Did you just feel tired?
yeah, it was kind of tiring, and you just, I don't know, it's just kind of a weird feeling to have. I'd never really felt like that before. It wasn't like you were on some kind of major drug that made you feel just really woozy or anything, but
For women, we tend to, at least I do, I'm kind of a bossy person. So I don't know if you are that kind of person in your relationship. Did you allow your family to help you?
Some, but then sometimes you didn't want to be treated like a handicapped person, you know.
Right.
And sometimes Michael was really good with helping me and everything, you know. And sometimes, you know, he would just get a little bit too much
help
involved in there, and so. But you know, and I let him know. Look, I appreciate it and everything, but you know, I can still function. You know, I'm okay, and and I guess that's one thing, you know, and having that support and everything. And he was very supportive, and sometimes when I would just be in a bad mood or something, you know, he'd stay out of my way.
Right. And that leads me to another question, because some people don't have a wonderful family structure to rely on. The Susan Komen, I guess, in Fosterweiler, they would have support groups, you think, for folks that need additional friends and I guess compatriots who could help them?
Yeah, they do have different programs there at Feistweiler. They have like things where you can go in and they have like an exercise or some type of meditation type things, you know, that you can get involved with. And I never felt necessary to do that, but I'm sure there are people that do. Yeah. And but I just found it to be a very pleasant situation, you know, and I felt like they were really interested in what I was going through.
Right.
And if I would tell them something that I was feeling or wasn't doing or should I do this or that, then they would tell me, oh, no, you really shouldn't do this, or yes, that's
So they give you the
fine.
parameters that they think are the best for you to
Right.
work in.
Right.
Yeah, that's great. Now we talked a little bit about the chemo. What about radiation? Did you have radiation treatment?
I'm just going to get started with that, just probably in the next week. I have gone in and they mark you up so they'll know exactly where the radiation should go, and I just got that done yesterday. So I'll be starting that probably next week. They're supposed to give me a call and let me know when I go in, and it will be like 5 days a week for about 5 weeks.
Okay.
So I go in, but they say it doesn't take but 10, 15 minutes
Just a quick
each
program.
session.
Well, we're going to come back with Lillian in just a moment and continue talking to her about her experiences with breast cancer. Stay with us.
Never met George Armani.
I don't know Ralph Lauren. Ann Taylor, Donna Corinne, no idea.
But I'd like to thank them for donating their clothes.
Our customers won't mind if their names are still sewn in them.
My mom did that to my clothes, too. Only she used a marker.
Goodwill. Good clothes, good prices, good idea.
Start a great new career today at Guys Academy Hair, Skin, and Nails, offering quality education in the Arclitect since 1954. Guys Academy, hands-on learning in the classroom and in the student salon with supervised instruction. Guys Academy, proud to be a CHI Environmental Partner School. Guys Academy, the latest techniques in hair care and styling. Guys Academy Hair, Skin, and Nails. Start a great new career today. Call now.
Welcome back. We're here talking with Lillian Campisi about her personal experiences with breast cancer. And as many people know me, they know that I like to put on wigs for fun or for the theater. But one of the things that chemo can cause is hair loss. And I want to talk with you, Lillian, a little bit about your experiences with changes in your body following the chemo. Let's talk first about hair loss. Did you sustain that?
Oh, yes. In fact, I have a wig on today.
Oh, you look great.
Yeah.
You look wonderful.
Thanks. After probably a couple of weeks after the chemo, I started combing through my hair, and there was a big piece of hair, a lot of hair coming out with the comb, you know, and I said, oh. And I said, I think it's time to go and get a wig.
So what happened? How did you go about that process?
Well, the American Cancer Society has a room that you can go in their office there, and it's nothing but wigs. There's red, there's black, there's gray,
You didn't
brown.
need any platinum blonde or anything like me?
Well, they tried one on. It was about the length of your hair, and she said, "Oh, let me try." It's a human hair wig, and she says, "This would look good." And I thought, Michael said, "Oh, it does look good on you." I said, "But it's not me, you know.
Right.
I don't want to be that different." And so I tried on a few more, and then they showed me the one I have on now, and I said, "I like this," you know. So that was my wig of choice.
Wig of choice.
And
is it easy to wear, the wig?
Yeah.
Yeah.
Very, very easy. And I bought this little brown thing that goes, skull cap thing that goes over your head, and then you just put the wig on over it, and then I have the wig head, and you can fix it on that, and you can wash it and fix it and everything.
Treat it just like your regular hair.
Yeah, and it hasn't really been bad at all. In fact, it's so nice. You know, it saves me a lot of time in the morning getting dressed.
Well, that's exactly right. My real hair does never do the things that my wig hair will do.
Right.
So, well, tell me about any other kind of physical changes that you experienced following chemo.
Well, I've had a lot of problems with I've had like a chemo peel or whatever, you know.
Okay.
I mean, your skin kind of sloughs off,
Okay.
you know, on here, on your arms and legs and everything, and you have these nice, smooth
Baby skin
baby
after that.
skin
Okay.
afterwards, and then now I'm going through a thing where my fingers and toes and feet are starting to peel. So,
Okay.
so you do come on, you know, you feel like one of these animals that sheds their skin,
Right,
you know.
right.
But I got to thinking it's a pretty good thing, because when it comes back so soft and
That's
smooth
right.
and everything. So it hasn't been that bad.
What about, have you had to take any kind of oral medications for your cancer?
I did at first. I had several medications I was on, and I have had some problems with this like congestion and everything, and it's better now than it was, but but I still have to clear my throat every once in a while, because it does affect me in that way.
Let's talk a little bit about your faith, because we talked a little bit before we started about how instrumental that has been in being able to maintain the positive outlook that you have.
Oh, yes.
Tell me a little bit about that.
I don't know what I would do if I didn't have my faith, because I was doing a lot of praying whenever I found the little lump at first, and then going through all the treatments and everything. And I don't know how people who do not have the Lord in their life handle things like this, because I just pray and ask Him for the strength that I need each day. And also, He gives me a peace, and I just know that everything's going to be okay, one way or the other. You know, I'm all right with it, you know. And what I have to go through, I go through, and it's not been that bad. I think if you dread things and you're afraid of it and everything, it makes the experience real horrific. And I've just gone through it, saying, you know, Lord, I know you're going to take me through it, and He has. He's taken me through it, and every step of the way. And plus, my church has been very supportive. I know I have people praying for me there. My Sunday school class, they pray for me. In fact, when I found out I first had cancer and everything, they all gathered around, and we have about 30 people in my class. They come around, they gathered, and hands-on prayed for me. And you just feel such power, you know, when you have that on your side. And it just gives me a peace, and I know that things are gonna be all right.
When you go through a difficult time like this, it's hard to think that there might be blessings that come out of it. As you sit here today, are there anything that you can point to that say, you know, this was a blessing that, but for this experience, I wouldn't have had?
Yeah. Well, one thing it has done, it's really given me a healthier appreciation of my husband. Michael, he has been so supportive and so good to me during this whole procedure and everything, and he's always been good about helping, but he's been really, really great with this. And I know sometimes I may not be in the best mood or whatever, but he's been a real trooper with it. And then my sister has been a real blessing to me. She has really helped me tremendously. She's come down and stayed and gone to doctor's visits with me, and been there with me when I found out. So we've just, we've just shared so much together and become closer, because it does kind of bring,
It makes you focus on what's important in life.
Yeah, and I guess it does. It has you focus more on the things that are the most important to you.
Lillian, when we come back, we want to talk a little bit about the road ahead. We've talked a little bit about what you've gone through up to this point, but stay with us and we're going to come back with Lillian Campisi.
Registered nurse Faith Peace and the Hands of Peace staff provide exceptional care for our clients, from folks who just want to relax to those with more challenging conditions. Our healing stone therapy is best for overall relaxation and therapeutic relief, actively using warm stones to melt the knots away. We have 2 locations to serve you, in the Bossier City Office Park at Old Minden and Northgate, and inside the BX Mall on Barksdale Air Force Base.
Welcome back. We're here talking with Lillian Campisi about her experiences with breast cancer. Lillian, we've talked about the road to this point. What is the road ahead look like for you?
I think it's a very positive road and everything. I've learned a lot from this experience, and I've had some bad things, but and I've had good things that have come from it too. One thing, I've lost a good bit of weight, because when you're going through chemo, sometimes food just don't taste as good as you would like for it to, and you just don't feel like eating anything because it doesn't taste right. But when you start getting your taste buds back and everything, that's only a temporary thing, have not tasting, but it is nice to get your taste back. And but I am trying to keep that weight that I lost off, because I needed to lose it anyway. So I never had the willpower on my own, so I guess maybe this was a help in that respect.
What do the doctors say? You're going to go through a course of radiation, and then what's next after that?
After radiation, they'll do a PET scan.
Okay.
And what that does, it goes over your whole body, and it will see how effective the treatments and everything have been. So hopefully it's going to say it was a success.
Nice and clear.
That's what I'm hoping to hear.
Well, Lillian, why don't you share with the audience what you think they need to know about breast cancer?
Breast cancer is something that people have always been so frightened of and everything, because it's a very personal part of your body, and women aren't the only ones who get breast cancer. Men can have breast cancer also. And the thing of it is don't be afraid. Don't be afraid of it, and let fear keep you from doing what you know you need to do. And you need to go to the doctor. You need to have it checked out and go from there, because there is life after breast cancer.
Oh,
and I intend to live mine to the fullest.
Lillian, thank you so much for sharing your experience with us, and thank you for joining us. Stick with us next time for another episode of Shreveport Bossier Metro Talk.